What's up?
What's up?
Kalen's on here, so do I have to keep it PG?
No. That kid cusses like a sailor. Bad
uh,
habit.
Joey said no singing, please. Dude,
What kind
leave
of
me my singing. I have to do something while I wait for the stupid connection. So,
dancing? You have a pole back there?
a pool or a pole?
Pole.
In the bedroom.
That's what I heard. What filter? What crazy filters do you have going on today?
Today is like top model. I was gonna use the baby face one because it was hilarious, and it makes you look like it made me think that maybe I should get some lip injections.
Oh my.
Horrible. Social media ruins us.
Yes, it does. Yes, it does.
Actually, I don't even think I need these.
Probably not. I can
Probably not.
I can hear you well. Can you hear me okay?
Yeah, I can hear everything.
All right, sounds good.
So just
All right.
waiting for
Yep, I got
people to.
on today, so tell Charlie.
Oh, hey, I will. He's probably not watching downstairs, and he'll watch later. George said TikTok. No, dude, do you have TikTok? I can't get there yet.
Talon does.
I'm sure. I keep calling him Talon. Talon.
Talon.
Sorry. Oh, all right, guys. We've got a very fun topic. So it's funny because there's a bunch of people that understand that estrogen for men is extremely important. And then there's a whole group of, I guess I can call them haters, that are very stuck on the old research and think that blocking estrogen and everything is the way to go for men.
Right.
And, what's interesting is a lot of my clients who I do consults with and everything, as soon as they write down, what some of their symptoms are, and a lot of men, as we discussed, have dealt with erectile issues and everything. And a lot of the times I scroll down into the medication list, there's an estrogen blocker. So there's a big coincidence there. And, I guess the way that I will start this is to describe the basics for you guys. So, when you go to get your blood drawn, you may or may not get estrogen drawn, and that estrogen number is usually not a very accurate one for men. You know the difference with the sensitive and all that. But a lot of doctors now don't even test it because it doesn't really even matter for them, because a lot of doctors who see estrogen flagged high on paper, which it's going to be if someone's on TRT, automatically they give them an estrogen blocker. And we know that that's probably not the most ideal thing for them to do. And a lot of these guys leave TRT clinics and all that with estrogen blockers in hand, and maybe HCG also. And so they're not sure what's doing what.
Right. Yep.
So in your opinion, I want to bring it down to basics. Why do you think the mainstream medical world is still prescribing things like estrogen blockers when we know that it really does not matter for men, especially on TRT?
Yeah, I'll try to compress it. It's like an hour later. Truthfully, and it's everywhere too, right? And there's something called confirmation bias, where you learn something and then you have a very hard time unlearning it when you get new information. And medical community is notoriously slow at adopting that, but it's also bad in that way in kind of the fitness industry, right? Think of like all the bro science from the bodybuilder days. They were doing all this crazy stuff, massive doses of testosterone and estrogen blockers, and same thing. They just kind of get in there. Oh, well, so and so did, and then it's a hard habit to break. It's same thing in the medical community. We learned X, and then later on, it's a slow moving ship. So sometimes when you have a couple studies or anecdotes showing this, even if you get 10 more studies showing the opposite, it's a hard time for your brain to unlearn that. It's just, like I said, it's called confirmation bias, and some people have a very difficult time with it. I mean, look at the whole debacle back in the 80s and 90s with low fat, right? We thought low fat that's the way to fix it. Well, obviously now we know that was a big mistake, and fat is good, and all the low fat led to all this increase in processed foods and simple, simple sugars and all this crap that processed seed oils, and then we got fatter, right? And more metabolically unhealthy. And it took what, 10, 20, 30 years to right that ship, So it's the same thing with estrogen blockers. I think a lot of, especially when it's traditional docs who don't really dig in deep into the hormonal optimization space, they just don't know the current literature, quite frankly. I mean, I didn't know it either until I really did all my training and certifications and have been reading my butt off and studying and talking to doctors and reading studies. It takes time. I didn't know it either. So we're all guilty of it. It just takes time, So I think that's what it is. Kind of like you learn one thing. You're like, well, I learned from my parents to brush my teeth this way, and then really, really hard. And it's like, well, don't you know that you're going to damage your, whatever. Well, I'm just making up a silly example, but it's hard for you to unlearn that. And some people just don't want to do that because then you feel like you're admitting that you're wrong or they didn't know something, and it's a pride thing. They don't want to admit that and change the direction. But I think it's like that with anything in life. You got to be willing to admit you're wrong and be willing to learn new things, your mind to other possibilities. That's all there's to it.
Yeah. And for the record, guys, estrogen in men provides a lot of benefits. So we know when women are in menopause, we lack estrogen and progesterone, which are the two main female hormones. So a lot of women in menopause get osteoporosis because they don't have the estrogen to support bone density. And that is the same in men. And so they were showing DEXA scans. And by the way, there's a lot of studies we can send you guys on why suppressing and blocking estrogen is not the best idea. And the DEXA scans in these men were showing how their bone density was going down and how it was so detrimental to their health that it was a big eye opener for the medical community to realize, like, wow, this is serious. This is really affecting men. But not only that, it's neuroprotective, it's cardioprotective. It actually helps men with insulin sensitivity. It helps them manage visceral fat, libido as well. So, if you drive your estrogen down too low, we know that can be a source of erectile issues as well. And I do think a lot of it came from the bodybuilding community where, guys are on massive doses of testosterone in addition to other synthetic anabolics.
Right.
But testosterone replacement is completely safe. But if you go in super physiological doses combined with other things that were made in people's basements, then yes, you could have some cardiovascular issues. But also, if you're driving your estrogen into the ground, that's going to be a problem. And do you think that's why a lot of the bodybuilders have died from cardiac events, is because they've driven their estrogen down through the floor?
Absolutely. We've seen it more and more in the last couple of years, and I think that has a lot to do with it. Like Ali said, there's dozens of studies that have proven this, over and over again, that, men need estrogen too. You check an estradiol levels in someone in their 20s, and it's probably well over 70, 70 to 100. And you don't really get any benefits until you get up in that high number. And there's no benefits. It's kind of like testosterone women. It got a bad rap because they did some studies that showed an association. Well, association doesn't mean causation. In other words, it was kind of an innocent bystander. They sample a bunch of men which were overweight, and they found at baseline they had a high estrogen level, and they found out later they had a higher risk of all these things. Well, it wasn't because of the estrogen. It was because of their fat, all their visceral fat they had. They were unhealthy to begin with. They were insulin resistant. They had all this fat tissue that was inflammatory. They were not living a healthy lifestyle. And the estrogen was, because of that, the wrong kind of estrogen, probably estrone and estradiol and all these things. So it was an innocent bystander. So it was the underlying metabolic issue that was the issue. Now, if you actually take a study, and that's where people get it in their head, same with testosterone with women. Now, if you actually take a study where they put guys on, and they've done this, where they put guys on testosterone, then they put healthy guys on testosterone and an estrogen blocker. Let's do an actual intervention study where you give them a medicine and see what happens. Well, every single one of them has shown benefit with keeping estrogen high. Better mass, better cognitive function, better muscle mass, better libido. And the guys they blocked it, clearly they all did poorly. They increased fat. They increased visceral fat. They decreased libido. They had decreased erections. Their orgasms were less. So hey, if you want to have those orgasms, I know that's terrible to deal with. If you want to kind of take the edge off that, make it not very fun, go ahead and take your estrogen blockers. I don't care. If you want to get a limp dick, go ahead and take it. Because all these studies have clearly shown when you do an intervention that it's terrible. They their bones get more prone to osteoporosis, more fat, more metabolic, and become insulin resistant. which is going to predispose you to diabetes. So if you don't want to get diabetes, you have to do everything you can to maintain your insulin sensitivity. And then testosterone and estrogen, those are two ways to do it. So they thought, again, this is all for women, but the effects that we're getting from testosterone, as they dice it out in the studies, a lot of these were coming, actually the benefits were coming from estrogen, like increasing lean body mass, decreasing fat, increasing libido and erections was actually the benefit from the estrogen, not the testosterone. Now, the estrogen came from the testosterone because when you supplement, you optimize someone with testosterone, some of that gets converted into estrogen, but that's a good thing. When your level, people are worried about, oh, my going to get high, I'm going to get fat, I'm going to get gyno and all this. It just doesn't happen. It just doesn't happen.
No, and a lot of these guys, they throw around terms like estrogenic side effects or the side effects of estrogen. And that, would you agree, just comes mainly from poor management of somebody's protocol? So they're probably on too much, too little testosterone, or it's the frequency of injections that they're on.
I see that a lot with guys. I mean, not my favorite, but I've had other people who've come to me, and yeah, when they bump up their dose, or like you said, going really, really high, guys are bad at well, some is good, so more is better, right? Well, all of a sudden now they're retaining all this water, and they're thinking, oh, it must be my estrogen, bro. And it's no, not. I did a whole Instagram, YouTube video, 3-part series on testosterone and water retention, why that happens. It's not the estrogen. That's the bottom line. So, gyno, that's a true gyno is a genetic thing. It's actual tissue that causes discomfort. When guys say they're getting, boobies or bitch tits, well, that's fat. It's called fat. It's called insulin resistance. It's not. It's insulin resistance, and you got some subcutaneous fat there. That's what that's from. So, the whole estrogen effect thing doesn't happen. Now, anything's possible. Can you get that rare guy who's very sensitive to estradiol and it gets a little high? He has maybe some symptoms. I guess that could happen. I've never seen that. But again, it's usually from the testosterone, from the water retention, and the fact that they're probably medically unhealthy or they're on a bad protocol, all the above.
Yeah, and that's I think that the most frustrating thing too is, I obviously can't legally tell somebody, hey, you should split your dose in at least 2 injections a week, but I have to encourage them to talk to their doctor. And you won't believe the shit that I hear when they do that. And everything from, well, we need you to come into the office if it's going to be more than 1 injection a week, or we can't write a prescription for more needles. Okay, we all know where to find needles online. Legally our office won't, just things that make absolutely no sense. And then I'm like, all right, we need to find another practice that understands exactly how to give hormone replacement. Because as you know, they're also, like I said, getting sent out the door with testosterone, with the aromatase inhibitor, and with HCG. And if they feel worse, which some men don't feel great on onset of testosterone replacement just because they haven't found what works for them yet, but they don't know what is doing what when you're sent out the door with 3 medications.
Yeah, and that's the thing. A lot of these clinics will put people, they think it's, the kind of the old school cookbook medicine where you put everybody on a certain protocol no matter what, and that just doesn't fly. There's a medicine, there's a science to it, and there's art to it. You can't just kind of like you said, if you're just reading studies online and you're just counting patients, but you're not actually seeing patients or have that medical background and to dig in and actually see what's happening. It's a symphony, all these hormones and all these clinical things, not just hormones, but everything in their health, their history, their genetics, all these different things. So you mess with one, you mess with many other things. So it's not just a cookbook thing. It's a unique approach that you have to have hands on that and that experience to understand what the hell is going on metabolically in your body. You can't just put everybody on one. It's kind of like you can't put, okay, I want every single person needs to be doing 3 sets of 10 or you're not going to get hypertrophy. Period. Or everybody should do keto. No, everybody's unique. There's tweaks and twists, and it's even more so with medical issues. So yeah, you can't just do a cookbook approach. That's for sure.
Yeah, and I know that there's clients that I've worked with that I've sent to you where they were just right away, end range of estrogen, I think on LabCorp is 39. If it's 40, here you go. Here's the Arimidex, and they've been told to take it every day or whatever. And I have to encourage them as best I can. Maybe that's not the best idea, but talk to your doctor and all that. But they have you at least. But the physicians, they don't realize that the estradiol that is tested is only in the blood, not in the tissue.
Right.
So why is that like taken as verbatim? This is just the, even though it's a snapshot in time of what is like spilled out of the tissues, like why did we care about the number, and why was there even a range that was set for men?
Right. And it's like that with all hormones. Unfortunately, it was, if again, that the old axiom, you treat the patient, not the numbers. And that's kind of that is what I try to do. And I use the numbers as a guide, but unfortunately back in the, I don't know, the 80s, back somewhere in the 80s, 90s, it kind of got hijacked. It started, like, for example, in the endocrine world with thyroid. You read Dr. William, Dr. Broda, he's the classic, pioneer in thyroid. I'm actually reading a book right now back from the 70s. He was a brilliant guy. That's how they used to treat everybody, by symptoms. They treat all kinds of conditions. And then when the laboratory world came involved, then they started getting a little bit lazy, and instead of relying on their clinical exam skills, they started relying on a test. Like, oh, well, your TSH is normal, so you must be fine. Well, I'm tired, I'm gaining weight, I'm cold all the time. No, your TSH is fine. Well, no, because maybe your numbers are fine, but not getting into the cell. As you said, the levels inside the cell or in the tissue are different from what's floating around the bloodstream. Those hormones have to interact with the receptor work, and if those receptors are not working, kind of like insulin resistance. If insulin's floating around but it's not working, same thing. You can have resistance to your testosterone, to your estrogen, to your cortisol, to just about any hormone. So it has to get into the cell side to work, and there can be different reasons for that, from other hormonal abnormalities, lifestyle, et cetera, et cetera. Same thing with like testosterone and DHT. It doesn't matter what's floating around; it matters what's inside the prostate. So the numbers, yeah, use them as a rough guide, but you have to treat, one guy at level of 500 feels awesome, another guy feels like total crap, and there's a reason for that, and there's many nuances to it. So yeah, it doesn't matter. And as you mentioned earlier, there's for men, it's even better to do an ultra sensitive estradiol test, which will really give you a more accurate number. I don't always get that, honestly, because I'm really treating the patient. A lot of my colleagues, they don't even check estradiol on it.
Yeah, like it's not, I mean, because then you have nothing, because then it's not that there's like that nocebo effect where guys are hearing, oh, estrogen's bad, and then they see it in the red on their labs. They're going to think and then manifest some sort of side effect that they think is coming from too much estrogen, or claim they need to block it because they feel more moody, when it's really just a mismanagement of their actual dosage of testosterone.
Right.
So it's not like, you take one aspirin, you pretty much probably will feel fine, and like anybody else who takes one aspirin. But with hormones, it's like you said, everybody's unique. So again, somebody may need 100 milligrams of test a week. Somebody might need 200. Like, everyone is different. So as test goes up, your estrogen is also going to go up, but that is necessary, and that is what we want to happen, because that process gets completely cut when you go on an exogenous testosterone.
Exactly. So. Not to say I'll never, ever prescribe an anastrozole. I have one patient, who I occasionally, once a year, he actually has true gyno, where he gets a surgical scar and a lump, and it's painful. Right. And very low dose for like 2 weeks and done. And, there's other things that, for example, if someone does have an issue, I can put them on zinc. A healthy dose of zinc. It's a natural aromatase inhibitor, which has numerous health benefits without all the side effects of an anastrozole. But again, I rarely do that. Why people take zinc anyway. So I'm not to say, again, like, the docs are treating as a cook. I'm never going to get it. I have, but rarely does it need to be done. And again, so many benefits, as we're finding out, come from the estrogen. Some of the testosterone converting to the estrogen, building strong bones, cognitive function, libido, increasing lean body mass, increasing fat. Quite frankly, living longer. They did mortality studies with guys with lower testosterone and lower estrogen, and they just died earlier. So if you want to live longer, better, stronger, more, then keep your estrogen up. If you want, fat gut, a limp dick, and you want to die early, then go ahead and take your AIs if you don't need it. Now,
I don't know who doesn't want a rock hard boner. Like, come on.
Right. I'm just saying.
Just saying, I mean, so if somebody's not a patient of yours and they come to you, or what would your recommendation be for somebody who says, well, my doctor prescribed me, Arimidex. Do they just not need it, go off of it, because more than likely they probably don't need it? Or what would you say they should ask their physician? Like somebody who has absolutely zero symptoms of anything, and they're being strictly given that based off the paper.
Yeah, well, I mean, I would spend a little time with them, ask them, like, do you have any symptoms? Tell me about your health. Tell me about your family history. I'd run down the list of symptoms, all their medical history, except what they're taking, what, et cetera, and spend a little time. And more than likely, I'll find that they probably, and again, if they're fine, like anything, if you're taking, 5 medicines for blood pressure and diabetes, you probably don't need half those, especially if you lost weight, improve. So we could probably cut that out. And again, when you have 5 different medications and you're throwing them all out there, you don't know what's working, what's not. So I like the KISS approach, keep it as simple as possible. Start with just 1 or 2 things, see what works, make an adjustment, and then you can always layer on other things. Now, some people I will have to add multiple things at once. Someone needs testosterone and thyroid and all these things, and sometimes you have to, but again, kind of low and slow, start low and go, work your way up. But most of the time I'll find after taking a good history and, talking to them, I'll find that they were just giving it like, well, you don't need it. Stop it,
But if someone's not your patient and somebody listening, like their doctor has them on that, how would they approach their doctor about going off of it?
Yeah, I guess I would just have them ask them, say, hey, doc, why am I on this? Why do you think I need this? And what do you think would happen if I stopped? And, again, go back to your goals, like why they went there in the first place. What were their goals that they went? Are those goals being met? If they are, great. If not, or they're not sure, or they're not getting a good answer, then they probably need a second opinion.
Yeah. And that second opinion can be you.
Yeah. Happy to do it.
Yeah, it's amazing how many people, like with trainers or hairstylists, that we get emotionally attached to the person that's in charge of, our appearance or our health. But that, it's like a relationship. If the time has run out where it's benefiting each party, then it could be time to move on. And I, encourage people often that if, you feel like you're being treated like a piece of paper, you're asymptomatic to a lot of stuff, and you're just being given medications without an explanation or reasons why, we can provide you with the studies to bring to your doctor, and then you can move on safely if they're resistant against it. Just like anybody who doesn't have an open mind in normal life or fails to communicate effectively. So
absolutely. I mean, I see it all the time in patients, not just hormones. People are on, I'm on this medicine for cholesterol. Well, why? Oh, I don't know.
Yeah.
You want to find out, I had a lady that I talked to and she's been on it for decades. And I'm like, why? She said, I don't know. I guess my cholesterol was high. And when I dug back further, it was pretty much borderline normal. And I thought, you don't really probably need that. I would talk to your doctor about that. So you just, say, like you said, same with nutrition and training. Like, why do I need to eat only, red onions? I don't know, just because. Well, why? Ask those questions, dig a little bit,
Yeah, it's people have to be advocates for themselves, and we can help. And like, I feel like my job is to kind of direct people to the people that know what to do. Right. But there's still, you have to ask questions. I mean, there's no wrong question, especially when it comes to your personal health. And you guys have every right to know how you're functioning, and if you're functioning optimally as a man. It is your right. You're allowed to see your labs. You're allowed to understand why you're on a medication. If somebody cannot explain that, it is time to move on, because life is short.
Definitely. Yeah. Ask questions. Ask either one of us. We're both happy to answer questions. Reach out to me, message me on Instagram. I'm happy to answer questions. If you have to, anything you want to know, happy to do it.
No questions tonight, but I didn't expect any, because it's still very much a topic that's misunderstood. And like I said, there's a whole group of medical physician haters out there that I'm glad they didn't jump on tonight. But
I know.
That still don't believe this stuff. So like we said, if you guys are having resistance and you need studies, hit us up. We've got them all. They're just same reason that like female birth control, I don't know, hasn't changed since the 60s. It's time to find something new. But we're just realizing that research like years later. So this has been good. So this is good. So now hopefully you guys have a better understanding as to why men need estrogen, just like women need testosterone, which we've gone over twice. So maybe we'll have to do another one about men and estrogen, which we're happy to do. You know, and whatever you guys want to learn, message me or Eric, either one, let us know.
I'll pop some slides from a couple lectures, and showing some studies and some data over the next couple of days, just if anybody wants to read it, just quick summary pages, and we can find the actual studies. But happy to provide more information for further clarity, or just answer any questions related to hormone health optimization. Reach out.
Todd said we hit on all the key points. You are very welcome. Awesome. And your son said no TikTok, no dancing. He said you're very bad at dancing.
All right.
All right, guys. Thank you so much. And we
Fun.
will see you next time.
Talk to you later.
Have a
Bye.
good night.